I was putting together a lecture and I need a break. So I thought I'd come on and talk about diverticular disease. But diverticular disease is one of the most common digestive disorders, and a lot of people, especially as you age, are going to have these diverticular pockets. The way to diagnose them is with a CT scan or a colonoscopy, and they're literally ballooning off of the wall of the intestine. And that's not a problem inherently in itself, but if they get infected, then that's a real problem. So, from my perspective, the goal is to keep them from getting infected, keep you off of antibiotics and pain medication, and just not have to go to the emergency department. So, what are they caused by? Essentially by pressure. Years of constipation, even diarrhea. So, a lot of the end of the system, the sigmoid colon and rectum, take a lot of pressure because they're the end of a 30-foot system. So, if you add to that things like straining and constipation and even childbirth, then you can get these ballooning areas off of the large intestine, and once you have them, that's it. They're surgically, they could be removed, but 25% of people will never develop any problems, and the rest of the people will. Okay, so we've got these diverticula balloon-like structures. They're bulging off the end of the colon, and they're fine unless they get infected. And so, what I want to talk about is prevention. How do you prevent yourself from having a problem with these? You keep your bowels regular because constipation is a big no no. That can set things off. Make sure you're taking digestive support like digestive enzymes with your meals. And then chlorophyll is a really wonderful internal cleaner to keep things clean for you. And you can take it by mouth, 100 milligrams a day, but that's 30 feet away from where the problem is. So if you do an enema with chlorophyll, then you're going to have access right to that point where you're trying to treat. And the only contraindication would be if you're having active bleeding, in which case you should be in the emergency department because then you've got a perforation of that diverticula. So the classic signs are left lower abdominal pain, fever, nausea, bloating, and rectal bleeding. And again, rectal bleeding, this does not apply to you. Go to the emergency. What I have people do is when they're having a diverticular episode is stop all solid foods and just use clear liquids like broths and miso. And then I'll have them repeat a chlorophyll enema every half hour until the symptoms are gone. Usually you only need to do, max 3. If you've done 3 and you're still in pain, then go to the ER. And how you do is very simple. You go to the pharmacy, you buy a fleet prepackaged bottle of saline for enemas, dump a quart of it out, fill it up with liquid chlorophyll. You can buy that anywhere. And then repeat those. And it's very, very effective. You can also do castor oil packs to the area. Again, if symptoms don't improve, you go to the ER. But I've kept hundreds of people out of going in by using this treatment, and it might not be the most pleasant thing, but it does work.